Hi, this is Sarah Butler, and this is my informative speech. I'm going to go ahead and pan my audience here. I got one behind the lamp over there. There we go. Medical errors are the third leading cause of death in the United States. That doesn't even take into account what I want to talk to you guys about today. The Joint Commission, which is the leading accrediting factor for hospitals, has issued a new patient safety goal related to alarm fatigue. With all the new technologies in hospitals, alarms are becoming a big problem. Alarm fatigue is not when nurses get tired of hearing alarms, because it happens. We have nightmares about them. So, what I want to do today is tell you guys what alarm fatigue is. I want to give you some numbers to chew on related to alarm fatigue, and I also want to tell you some recommendations that other hospitals are doing to help combat the problem. So I did extensive research on alarm fatigue in the Bachelor's of Nursing program, and that is here. I'd like you guys to look through this. I'll pass it around just as a visual aid, just so you kind of know what I'm talking about. Okay? So first of all, the definition of alarm fatigue is when staff becomes desensitized to the alarms in a hospital. There's so many alarms that happen. Nurses or other staff can tend to turn those alarms, turn the volume down, or shut them off altogether, so they could actually miss a big problem that's going on. My local hospital has started an alarm fatigue task force, and they pointed out over 30 pieces of equipment in the hospital that have alarms that can go off. Whether it's a low battery or something became unplugged or a patient moved the wrong way, those still create alarms. They can be, like I said, IV pumps, blood pressure monitors, telemetry alarms. All those make noise that the nurses have to take care of. So some statistics about alarm fatigue. A study put out by Joint Commission, the big, like I said, front leaders of accrediting, said that there was 566 alarm-related deaths. 566. That number can be grossly underestimated because reporting to the Food and Drug Administration is not mandatory. So it could be thousands. It could be tens of thousands. All I know is that if one patient died because of an alarm, that's too many. So 566, it doesn't sound like much compared to all the hospitals that are around the country, but like I said, it's still a big number. My hospital had one negative patient outcome related to alarms, and that happened in 2003 in the surgical area. So there's just a couple numbers for you. And lastly, what I'd like to talk to you about are some recommendations. Laura Stokowski, an author for Medscape. Medscape is a leading journal for medical staff. She wrote that the Boston Medical Center, which is kind of leading the way in alarm fatigue, has started hiring staff members just to sit there and watch alarms. That's all they do. They sit there, they watch the heart monitors, they take care of alarms if they need to. They don't do any patient care. They change batteries all day. That can be expensive. The second thing that some hospitals are doing are having electronic monitors. If an IV, for instance, if an IV pump is beeping in a patient's room, that alarm gets sent to an electronic beeper on the nurse's side. She can see that an alarm is beeping in room 106 and go in there and take care of it. It doesn't necessarily alarm in the patient's room, which can make them happier as well. And the last thing, which is probably the most cost effective, is changing telemetry patches every day. Patients that are on the cardiac monitor, their skin gets flaky or they get sweaty and those patches can kind of come off, and that can lead to tons and tons and tons of false alarms. So just by changing those every day has shown to decrease the alarms at Boston Medical Center by thousands. They say that 85 to 99% of the alarms are false, like I said before. So to recap, I have told you what alarm fatigue is. I gave you some numbers to chew on about alarm fatigue, and I told you about some recommendations that some other hospitals are doing. And try to remember, if you guys are ever in the hospital and you hear constant alarms, it's not that the nurse is ignoring them, it's just that they might not hear them. So hit your patient call light. Okay? Thank you. Oh, you have a question?
Yes, please. What are the top two causes of death?
Oh, the top 2 causes of death before alarm fatigue. Number 1 is heart disease, and number 2 is cancer. Not a specific cancer, just cancer. Okay?
Thank you.
Thank you.